Afternoon, everyone. My name is Mark Rasnake. I'm one of the infectious diseases physicians here, and I think you've all kind of heard regularly from us as we try to communicate with you about the COVID-19 response here, and wanted to talk primarily today about the COVID-19 vaccination, as well as about the impact of Delta and the other variants that we're seeing and the new surge that has kind of impacted our local area and the medical center. Just first off, this is a month that I shared on Workplace the other day that's very important to me. Last August, I started my vaccination series as part of the Pfizer vaccine clinical trial. And I had never participated in a clinical trial before as a research subject, so that was a new experience for me. But when I read the data, I had the privilege that some research trial participants don't have for other things, in that I was already following what was being published on the product that I would be potentially exposing myself to. And at the time I took the shot, there were a few hundred people nationally that had had the Pfizer vaccine product. But the early data just looked exceptional in terms of how much of an immune response it provoked and basically how well tolerated it was by people that received it. And basically made a decision on everything I had read that this was a reasonable thing for me to do to participate in this. And I had high confidence that it would be safe. No idea, as with any research study, that whether it's actually going to work or not until you look at the data. And just because it makes the blood work look good, it doesn't always mean it protects you from disease. But I got the shot, started in August, finished my booster early September. I've been fully vaccinated for almost a year now. And as COVID impacted the medical center over the winter of 2020 and through the spring, as we went into that winter, I still remember reading the vaccine efficacy studies that got published in November, and I was just floored by how effective that vaccine was. That early effectiveness against the original strain came in right about 95%. And retroactively, I was just thrilled that I had gotten early access to a vaccine that was so powerful at protecting me. And it gave me a level of protection that very few of our other team members had. And we had several other team members that had participated in other trials, including several folks in our own department in infection prevention that were part of the Moderna vaccine trial, and also had the same effectiveness that was discussed at about the same time. And so it led us to have a tremendous amount of enthusiasm and confidence when in mid-December we started rolling out this vaccine to our own team members. And December 17th was when we got access to the vaccine here for the first time. And I had this initial rush of enthusiasm for the vaccine. And there were tremendous numbers of people that were literally tripping over themselves to get in line to get access to this vaccine when we first started. The demand was incredible. The demand has faded over time, and we've gotten through that initial batch of enthusiastic adopters. And what I really want to do today is give a message to anyone that's still on the fence and they're not sure if this vaccine is right for them. I'm a year out. All the side effects that I had from this vaccine were all in the first couple days after the booster shot. The fever, the sore arm, the body aches. Ever since then, all I've had from this vaccine is protection and confidence that it's providing me a great deal of safety from the vaccine. And literally the only long-term effect that I have from this vaccine is immunity, and that is a tremendous thing. And that's something that we need to have more people gain access to. The vaccine, like with all vaccines, over time, the antibodies and the immune response you have to it can fade. And we're starting to see some breakthrough infections of people that were vaccinated a long time ago, 8 months ago, with the vaccine products that we currently have available. And people are getting cases of COVID. The thing to know about those, however, is that these cases are almost exclusively mild cases. It is extraordinarily unlikely that you'll end up in the hospital or have a life-threatening complication with COVID if you've been fully vaccinated. And the data that we have in the hospital bears that out. As Delta has rolled through the area, we're consistently seeing over 90% of our total inpatients are unvaccinated, and almost all of our ICU patients are unvaccinated. It is very uncommon for us to have a vaccinated individual that gets sick enough to require critical care. So the message is that even though you might get a breakthrough infection, and even those are still uncommon, but even if you do get a breakthrough infection, it's going to be much more mild than someone that's unvaccinated that gets exposed to COVID. We're going to see more variants arise. There's going to be a need for boosters. We sent out the announcement in last night's email that we will be able to start offering the third dose to our vaccinated healthcare workers as early as September the 20th. And I think that's going to be important. The research study that I was in, I got a booster dose a few months back as part of that study. I don't know whether I received saline or the active drug. They didn't tell me. That's part of being in a clinical trial, is you don't know which one you received. Once the vaccine is authorized for boosters, they basically told me they will offer me the active drug if I got placebo, or, in retrospect, know that I got something that protected me. But because of those trials that have been done looking at the booster doses, the data looks really good that third dose will really ramp up your antibody levels, give you a more durable immune response, and will also provide better protection for the Delta variant. That booster dose seems to really drive up the protection against Delta. And so we're looking forward to offering that to our team members starting next month. But my priority talking to you right now is not to kind of hype the booster dose and get people thinking about that. That's a month away. Over the next 4 weeks, we really need to get as many folks that haven't had that initial series of vaccination started. And we've done everything we can to get the access in our vaccine clinic, walk-in only, should be as convenient as it possibly can be, to make sure we get as many people started so that when we start doing the boosters in September, we have as many people at least basically protected with the starter doses. Again, the Delta variant, very effective protection from severe illness, and then we're hoping that the booster dose will be that additional layer of protection that we need to keep you from getting sick at all. Other things is, it's good to not assume that if you're young and healthy and active, you are invulnerable to COVID. We have seen quite a few young people in the hospital with this wave. The first wave of COVID that we saw last year, a lot of elderly patients, people getting sick in nursing homes. Our average age has dropped substantially. We're seeing considerable numbers of people in their 30s and 40s that are showing up in the hospital right now, sick enough with COVID to require hospitalization. We also have data that even if you're not sick enough to be hospitalized, the lingering long-term effects of COVID are legitimate and they're real. And there are people that can take weeks to months to recover from the brain fog and the memory problems that happen from COVID infection. Cardiac injury with myocarditis, a large study in athletes published out of the Big Ten conference earlier this year showed that a substantial percentage of these young athletes with mild cases of COVID had sustained heart damage from this. And this is the healthiest, youngest active population you can get, is an NCAA athlete population. And, they're getting heart damage from it. It's important to, just because you're young, it's still a significant threat from COVID. The other, initially when we started this vaccine, we weren't quite sure what the impact of COVID would be on pregnant women and how safe the vaccines would be. We didn't see any reason to suspect they were unsafe, but there just hadn't been a lot of experience with it. So people were fairly cautious during the first months of the rollout. But as data has accumulated with tens of thousands of pregnant women being vaccinated in the US, it's abundantly clear that the vaccine is safe and effective at protecting pregnant women from COVID infection. And we know there can be some catastrophic consequences when a pregnant woman catches COVID. We've seen some significant issues with that in terms of young women, no medical issues otherwise, that have had very significant health issues with COVID infection, whereas there's no evidence that the vaccine presents any unique harms to pregnant women or their developing child. And we're now with confidence recommending the COVID vaccine for all women, pregnant, lactating, trying to get pregnant. It's extremely safe, extremely effective, and it is much more desirable to take this vaccine even earlier in the stages of its rollout than to risk a potential catastrophic outcome from COVID infection. And that's a very clear message we're trying to send now. Hesitancy is only natural. Anything that's new, and especially with vaccines, this is just part of what's wired into us as human beings, is to be suspicious about things we put into our body. That's a very natural response. It's a very natural feeling. We as physicians and we as vaccinated coworkers need to be very compassionate about people that still have some doubts. But we also need to be very clear about sharing our experiences and sharing our knowledge as well about how effective and safe these vaccines are at protecting people from COVID. We need to acknowledge that people having doubts and concerns is a very normal thing. It's a human response. but we need to present the good data. We also need to be someone that is a voice, a familiar voice, or somebody that they trust. And someone might not trust me as a physician that they've never seen before, but somebody might trust you as their friend, their coworker, somebody that they've been, involved with outside of work, and you trust each other as close friends. That message may be as much or more impactful coming from you as a peer and a colleague than we're going to get across as a physician. So I would really like all of us that have been involved in this vaccination process to share your stories, to encourage your friends, to basically be that voice of understanding and that voice of reason that can kind of help overcome some of these very natural concerns that people have. A few issues that we are anticipating in the next couple months, and besides the booster, is it will most likely be next month in September that the Pfizer vaccine product, and possibly Moderna as well, will be fully approved by the FDA. That will allow us as physicians to administer this vaccine for unique situations that aren't necessarily perfectly aligned with the emergency use authorization protocols. Right now, there are people that we would, as physicians, potentially offer booster doses to, and our hands are kind of tied by the protocols. Once this vaccine is fully approved, it gives us as physicians flexibility in making individualized decisions on offering these doses to additional people. And it also, I think, will help allay some concerns that people have about the vaccine when it finally gets that final seal of approval from FDA, that all the material, all the research, fully vetted, fully approved. And again, I suspect that will be within the next 4 weeks, sometime in September when that happens. So that's kind of the main issues that I had prepared to talk about, and there's a few questions we've received in advance, and I'm going to address a few of those, and then if other things come in, we'll get into that. One of the questions was, do we here at UT test for the Delta variant? And we do not do a specific test for Delta. The way that works is public health authorities will basically monitor samples of testing across the state. And it's like with polling, you don't ask everyone who they're voting for, you just take a sample, 1 out of every 1,000, 1 out of every 10,000 tests. And what we've seen is 99% of what's circulating, not just in the United States, but also locally here in Tennessee, is the Delta variant. Really nothing else is circulating. So, and this is basically you just randomly select periodic COVID tests to sequence them, and those are all showing up as Delta. It's about the only thing going around now. One of the other things I've addressed from a team member is people that have had both shots, will they need a booster? Right now, it looks like that booster is going to be very beneficial and effective, and we should be offering those to you in September. September 20th is the date the Centers for Disease Control has announced that we'll be able to start offering boosters, and it has to be 8 months after your second dose. So folks that got their second dose, say in March or April, will need to wait for 8 months from that second dose to be eligible for a booster. For the larger percentage of our medical staff, the folks that got vaccinated early on in December and January was their booster, it'll be 8 months after that January booster that we can start offering. That's why they're looking at September for that. People that have had COVID, can they receive a booster shot? Very good question. You can, and it seems to be extremely effective at offering you higher levels of antibody protection, and it's probably more protective than vaccination alone. To folks that have had COVID before that get that booster get a very diverse antibody response that seems to cover some of the variants. We obviously don't want someone to get COVID just to get that diverse immune response, but for those that have had it already that are concerned about the booster, they're very safe. The one thing we want people to do is be fully recovered from their COVID before they consider getting that booster. After you've had COVID, you're basically invulnerable for at least 90 days to another infection if you have a normal immune system. So you don't have to rush that process. So let your body heal, let your immune system return to normal after that infection. Get back to where you need to be physically so that you feel good again. And then once you've fully recovered from COVID, you can start the vaccination process. Right now, the recommendation is to get 2 full doses. We know that the first dose that you get is the most important, but again, that COVID with 2 booster doses after that will probably provide you with an extremely long duration of high-level immunity. More research studies being published on that. We learn more as we go along, but it does seem to provide you an extra level of protection. here's another a good question, which is what are we doing? This is less vaccine and more treatment related. What do we do to treat outpatients with coronavirus infection to try to keep them healthy as we can and keep them from being hospitalized? And this is a very challenging field. We have several tools that we can use for hospitalized patients. We really only have one therapeutic tool that we can offer to outpatients that will prevent the progression of COVID disease to more severe forms, and that's our monoclonal antibody infusions. And Dr. Van Zyl and her team with the Monoclonal Antibody Infusion Center have gone to great lengths over the last few weeks to scale up our ability to treat more and more patients. This is the only treatment that has been shown to be effective for outpatients with COVID infection, and we're currently offering it to anyone that meets high-risk features, anyone over 65 or anyone with certain chronic medical illnesses, and this is all based on referral from people's primary care physicians if they have COVID. And these monoclonal antibody infusions do show that they can reduce progression to severe COVID and cut down the number of people that require hospitalization. There are things that don't work that should generally be avoided. The only thing that the NIH says don't use for outpatients with COVID are steroids. We've seen a fair amount of steroid use, but sometimes that can be dangerous. The steroid use has only really been shown to be effective in the people that are the sickest, that require hospitalization, and they're almost on a ventilator. That's the level of disease where steroids really can help. But the NIH recommends against the use of steroids for outpatients. And that's frustrating for our primary care docs because we have a lot more tools to bring to the table on the inpatient side of things, but there, unfortunately at this point, aren't many therapeutics beyond the monoclonal antibodies that help outpatients. Unreliable information about breakthrough infections and other things like that. This is, one of the reasons we've tried to be as effective as we can on communicating with people is we want to try to provide you the most reliable information possible. And it's really difficult when you look online to sort out the good from the bad. And the reliable information we're seeing right now is that people that are vaccinated have a low rate of getting severe COVID and a low rate of getting infected whatsoever. People that have had prior COVID infection seem to have a low rate of getting second cases. It seems to provide them some degree of protection. But people that have had prior COVID infection that then get vaccinated have extremely high levels of protection. And so that's one of the reasons it's just a lot easier to have everyone get the vaccine, whether you've had it or not. Everyone, whether you've never been exposed to COVID or whether you've had it before, everyone that gets the vaccine is going to benefit from that. And I'm very confident in being able to say that. Other vaccines, like the choice between one vaccine or the other, is one more or less effective against the Delta variant, Moderna or Pfizer. They're both within a few percentage points of each other. I would say get whatever vaccine you can get access to the quickest. We still continue to offer Pfizer here at the medical center, but if your local pharmacy has Moderna and that would be more convenient to you, they're largely interchangeable in my mind. I would take whichever vaccine is the easiest and the most straightforward. When it comes to boosters, we're recommending that you boost with the same product you started with, but if for whatever reason, if you started with Pfizer and your local pharmacy will only give you access to Moderna for the booster, or you started with Moderna and you want to get a booster here, the way things are looking, we'll be able to offer you boosters with whatever we have available. You're not forced to stay with the same vaccine you started with, but the current recommendation is the best data, the best research involves studies where it's boosting with the same product. And so we try to steer our patients to stay as close to what the good studies are showing as we can. So if you started with one product, it's best to get your booster with the same product you started with. Let's see. Other questions? How do we maintain our safety of the medical center in terms of people with COVID? That's really important as the cases ramp up in the community, that all of our team members, doctors, nurses, and physicians are vigilant for people that might have COVID-related illness and might not have been tested. This is a very variable disease. People can come in initially with chest pain and it looks like a cardiac issues, but 2 days after they're here, they start to get sniffles and body aches, and sometimes that might be overlooked. And I think part of our overall philosophy here at the hospital is if you're concerned about a safety issue, speak up. If you are worried that somebody might be there that has COVID symptoms and somebody hasn't tested yet, communicate to your fellow staff, communicate to the physicians, communicate to the primary services. And, we need to be vigilant about, having people maybe unrecognized. And this is a very complicated disease. It can be subtle in its presentation. And I think just having that trust relationship with us and our colleagues and voicing our concerns with our peers to make sure we catch everything we can is really important to maintaining safety. So that's all the ones I had ready to answer.
Yeah,
if there's any more
a few. Thank you, Dr. Rasnake. So one interesting question. So just a big thank you to medical professionals like yourself for all you've been doing. And then the question is, how does this new wave of COVID how is it similar or different from the first wave? And could you maybe just speak to this new wave?
Yeah, so this wave is coming with a much more steep peak in terms of the trajectory of cases, how fast they're coming in. Part of that is during the first wave, that was a lot of community mitigation measures. A lot of things were shut down. There were masking regulations in place. There was a lot of social distancing. This particular wave is happening with a more contagious variant and possibly less community mitigation measures in effect. So it's a much more steep curve on the upswing. And again, a lot of younger patients. And so Delta is clearly easier to spread person to person than the original version of COVID that we dealt with last year. So it feels like it's just coming up on us a lot faster. We have less time from day to day to prepare for what the next week's caseload will be.
Yeah. You hit on this next question a little bit, but somebody I think who is just joining us is saying they've heard with this new wave that a lot of younger people are being affected, and maybe could you just revisit that a little bit?
Sure. So one of the reasons the younger people are disproportionately affected this time around is a lot of our older adults took advantage of the vaccine back earlier in the pandemic. If you look at the vaccination coverage in older adults, it's much, much higher. I think it's about 80% in over 65s, even in our local area where the vaccination uptake has been lower. Our cases in the younger population right now is largely driven by the fact that they're the unvaccinated population. They're the ones that are the most vulnerable, and that's the group that's impacted the most. And those with the higher perceived level of risk from COVID, most of those patients got vaccinated back in the spring when it was available to them. Unfortunately, the younger populations might not have had that same perception of personal risk, and so we have less vaccination coverage in that group. And that's the one that is showing up the most in our hospital now.
And then any advice from you about somebody who's afraid to come to the hospital for being, something else because of COVID?
Sure. So, a hospital is probably still a safer place for you to be these days than any other area. We have mitigation measures to try to screen people that are sick from coming in the first place. We, have protocols in place for masking. We have higher levels of vaccination coverage in our staff than you're going to see in the community. And so the hospital, the impact of deferring necessary medical care can be substantial, and we've been dealing with that over the last several months in terms of trying to care for folks that might have been nervous about coming in for medical care. That's important to know that we've done all that we can to make this a safe medical center and a safe environment for people to come and get care.
Great. And one more question, because I know your time, you have a lot on your plate today, but just revisit, somebody is asking about, there's so much information out there. I know you talked about this earlier, about that having questions is natural, but what would you say to somebody who still maybe has questions as far as like where to go for good information about this?
Yeah, good information is so hard to find, and the best place to focus on that is the information that the CDC provides on their webpage has been consistently reliable for me since the start of this epidemic. I view them as a reliable source. I have colleagues from my military days that have been working on this COVID response as part of the CDC's response efforts since this started. I know these people personally. I fully trust them to provide me with good information, and that they have a team that has been under a tremendous amount of stress and workload over the last year and a half, but they continue to provide reliable information. National Institutes of Health, same story. They have very good, robust treatment protocols. And then what we provide to you, we do our best as a team when we send out information in our nightly communications to make sure we give you the best possible information that we can. And we can't always address every topic. And if we have a blind spot, if there's a topic we haven't discussed that would be a benefit, send an email to the COVID information email line that we have. Contact us on that. And if it's something that we just haven't addressed, we'll try to get you the best information we can. The medical journals are filled with about 2,000 articles a week on COVID. It's completely impossible to keep up. Only a tiny fraction of those studies have information that's of practice-changing benefit. The rest of them just generate a lot of clutter. So even those of us that try to keep up with this, when you think about 2,000 articles a week, it's impossible for us to keep up with every single research study. I personally lean heavily on the Infectious Diseases Society of America. That is an incredibly valuable resource for me. They have public information that they provide on their website. They have stuff that's more down in the weeds that's written on the doctor level that you might need to be an infectious disease doc to really engage with that content, but they also have a lot of information for the public. And that's been a very valuable resource for me, getting summaries of all the massive amounts of data. This is really a team effort on the part of various organizations around the country to get the best data, distill it down to some really good focused messages, and get that information out there so that we can use it.
Well, thank you so much for your time, and we'll share any other questions as appropriate with you, but thank you for all your work.
Thanks, everyone. Thanks for tuning in. And again, we encourage everyone that hasn't had it yet, get your vaccine, and starting in September, everyone that's been through round 1 and 2, we look forward to offering you round 3.